Hi, everybody. I'm Sandy Pellin from MomLifeTV, and I'm here today with Marissa Sherov. She is a holistic psychotherapist, a maternal mental health specialist, a mindfulness teacher, and an integrative nutrition health coach at the Nesting Place. Marissa is trained in the diagnosis and treatment of perinatal mood and anxiety disorders, PMADs, by Postpartum Support International. She's been trained and mentored by Karen Kleinman, MSW, LCSW, the director of Postpartum Stress Center in Philadelphia, and received postgraduate certificate training in the assessment, treatment, and advanced clinical practice of PMADs. Today, she works with parents to help them navigate challenges in their new roles, find balance, decrease their anxiety, improve their mood, feel connected with their baby, and so much more. In 2020, Marissa became the mental health director at the Nesting Place, which is a wellness center based in Long Island, created for moms by moms. They provide a comprehensive and holistic treatment approach to meet the various needs of moms along their motherhood journey. Thank you, Marissa, for being here today, and welcome.
Thank you for having me.
Sure. Now, you're a mom to two boys. Just tell me a little bit about your journey there and how your life changed, and a little bit about your story on how you started doing what you're doing today.
Yeah, sure. My journey to motherhood is such an important piece to the work that I do now with my, with the moms that I work with. So, I'm always excited and humbled to have the opportunity to share it. So thank you for asking that question. I am a mom of two boys. As you said, they are fraternal twins. They just turned 7 last week in the middle of July. Here we are, sort of losing track of days these days. But they were born via IVF. We struggled for many years to conceive, and after many rounds of failed IVF cycles and other fertility treatments, we were finally lucky enough to have two healthy boys. So part of, really all of the reason why I do what I do is because of the experience that I had, in my journey in trying to become a mom. I realized how little support there really is out there for moms, whether conceiving naturally comes easy, or however you become a parent, it's never an easy challenge, and so that's part of why I was a clinical social worker prior to becoming a mom, but that was really the main reason why I sort of shifted focus and made sure to really hone in on all of the skills and the training that I have now, so that I can, provide the support and services to moms and parents in need.
Yeah, and having all that firsthand experience, I'm sure really was an eye-opener to you in what moms are going through. So why is it important that we prioritize the mental health of moms today?
Well, for one, let me start by saying that, we really can't ensure the well-being of children if we aren't prioritizing the needs of moms and parents. And that is because, without moms having, mental health and stability and quality of life, it's near impossible to ensure that their children receive the same type of quality of life. And we know that there are so many moms that struggle with their mental health while trying to get pregnant, during pregnancy, in the postpartum period, and then years thereafter. The work that we do in the maternal mental health field covers sort of the continuum of trying to become a mom all the way to the seasoned mom, who has maybe teenagers or older children. And so we know that moms' mental health needs are often overlooked or dismissed because we think that, children need to be the priority. And while they certainly do, we miss the piece that without moms being sort of top priority, we can't then make sure that our children are within that category of top priority too. I use the analogy a lot with my clients and in the work that I do, about the oxygen mask kind of metaphor. And that is, we can't help other people breathe oxygen if we ourselves don't have oxygen to breathe. And and so that's why prioritizing the mental health of moms is so important. We help them to see why not only do they deserve to have oxygen to breathe, but that they need to have oxygen to breathe in order for them to be able to help their children breathe.
One of the things that you mentioned is just that journey to getting pregnant and how stressful that could be. So maybe you can tell us a little bit about your experience with just the mental health before and during, before getting pregnant, that mindset. And also during pregnancy, mental health is a big issue. Even before postpartum, depression could set in. There could be some depression before that. Can you just tell us a little bit about that?
Yeah, absolutely. I mean, even just the stress of trying to get pregnant. For most women, that doesn't come easy. We think, you just have, sexual intercourse with your loving partner and everything's going to be okay and you'll get pregnant right away. And unfortunately, that isn't always the case. And not everyone can conceive naturally for so many different reasons. So even just the stress, the worry, the fear of the unknown, what will the outcome be? That in and of itself puts so many women at risk for developing anxiety and depression, and stress-related mental health responses that can have an impact on, their ability to conceive and to have a healthy pregnancy and postpartum period as well. So just the stress alone, there is so much uncertainty, and that can exacerbate anxiety in anyone who already struggles with their anxiety before trying to conceive. And then, of course, that sort of just carries through during pregnancy. There's, again, so much uncertainty. We know that anxiety has very much to do with the fear of being out of control and the fear of unknown. And I mean, let's face it, that's what so much of pregnancy is about. It's, putting your faith into, your medical providers and a lot of, let's wait and see. And that's a really hard sort of concept and headspace for so many of us to accept and embrace, especially if you already have, had difficulty conceiving and, or you struggle with anxiety or other mental health issues beforehand. And then further down in the postpartum period, you sort of add more of the unknown and that uncertainty. And that definitely increases your risk for anxiety, for stress, and then there's just so much more. We all bring our own story to, our motherhood journey, and that story, very much has to do with how our mental health will be impacted. And so there are so many various risk factors to why someone would develop a perinatal mood or anxiety disorder during pregnancy and postpartum. And there's just not nearly enough information out there. We don't talk about it nearly enough. It's still so taboo to talk about mental health, especially as women, especially as moms. And if we don't talk about it and we don't shed light to it and bring awareness to it, then so many women will be suffering in silence and not realizing, how common this actually really is and how important it is for them to get help that they need.
Exactly. And, one thing that really would add to stress is if it's an unexpected pregnancy. I mean, there's so many women that, don't necessarily plan out to have a baby and they find themselves pregnant, or maybe they're going to be a single mom and there's all the anxiety of balancing that and work and finding a support system. Do you treat those women a little differently, or is it sort of the same with that anxiety?
Yeah, that's a really great point. Not everyone is ready to have a baby. Not everyone is ready to become a mom. And some pregnancies happen unexpectedly, as you said. And without a doubt, whether you plan it or, it was unplanned and totally unexpected, there are still the same mental health implications as would be for someone who had planned it or perhaps tried all these years or whatever. Yeah. Different circumstances, but still could have an impact on your mental health. And actually, a big part of why so many moms often struggle with anxiety or depression or other mental health issues, either during the pregnancy or in the postpartum period, has a lot to do with the change in their identity. Having to sort of accept that their life before becoming a parent is no more, and that change in identity is really challenging. No one prepares us for that part. A lot of new parents know it's going to be hard. There'll be lots of sleepless nights, but no one ever says you're really going to miss, your old life before this, and that it's okay if you feel that way. It's okay if you are fantasizing about what life was before you had children. That's okay. We don't talk about that and normalize that nearly enough. And that's a big challenge for a lot of women who didn't put much planning and became pregnant unexpectedly. That sort of forces them to have to really face that shift in identity before maybe they're ready.
Yeah, absolutely. So what do you think that is some of the biggest struggles that moms face today? I mean, besides COVID.
Yeah, we could have a whole discussion just on COVID-related struggles, right? This has been a real challenge for all of us.
Yeah.
But sort of in general, we touched on it before. Mom's mental health, mom's overall well-being isn't a priority. For so long, we view a mother as selfless, as putting her needs after the needs of her children and her family, right? And while that is important, of course, that isn't what makes a mom necessarily a good mom. And culturally and societally, we really need to shift our definition of what a good mom or the perfect mom is. And I think that right now the way that we view that is, someone who is selfless, who does put the needs of others before herself, who doesn't prioritize self-care, because if so, then she'll be looked at as selfish or not a nurturer like a true mother is supposed to be. And so we have all of these sort of judgments and preconceived notions of what a mom is supposed to be, that we forget about focusing in on what a mom really needs to be. And part of that is a mom needs to be a mom to herself too.
It's true.
So many people, they come over, they want to see the new baby, they want to hold the new baby. We forget, who's holding the new mom? Who is there to help her and with this identity change and all of the different changes that go, a new mother goes through, both physically, emotionally, and mentally when they become a new mom. And so I do think that one of the biggest struggles that moms face today, sort of that modern mom today, is embracing all of that, figuring out what a mom really means. And letting go of those preconceived notions of that perfect mom or that good mom, and instead figure out a way to just sort of be mom enough. We don't need to put our, raise the bar and have such high expectations for ourselves, despite all the pressure we might feel from, our family, from culture, from society, because even in 2020, that is still very much there.
Yeah.
And we could talk about sort of that for hours. I certainly could talk about that for hours. It's something I'm very passionate about, is sort of redefining what mothering looks like. And that part of that is figuring out a way to mother yourself. And if you don't know how to do that, find people that can help you do that.
Yeah, absolutely. And do you find that the bulk of the people that you help are they new moms, or is it really moms of all ages? Because at any stage of parenting, you can struggle.
Absolutely. Yeah. And that's why, we have in the field, we've sort of created this term, maternal mental health specialists. And, there's lots of different terms sort of being thrown around. Some people say that they're perinatal mood and anxiety disorder specialists. And that's an important title as well. And they often mean very similar things. But when we talk about maternal mental health, we do talk about the mental health of mothers across the span of motherhood. And so the majority of moms that I work with typically are newer moms. But I do work with some moms who are, a little bit more seasoned, as I like to say, maybe moms who have older children. And that's because, our mental health, regardless of if you're a mom or not, our mental health and our mental health needs change depending on the circumstances in our life, the current stressors that we're experiencing in our life. And so there might be a mom who, did really well with the early years of her, child's life. Maybe she didn't struggle with her mental health then, but perhaps now she's struggling with other things. Maybe she's getting back to work and she's struggling with figuring out work-life balance, or, maybe she experienced a loss and that's impacting her ability to parent and be present in her life and sort of be the mom she wants to be. And so I see moms of all ages with children of all ages for sure, because we know that, moms are human.
Right.
and us humans, we struggle, and, we do need support sometimes too.
Absolutely. So you talk about a mind and body approach to healing. Why is holistic approach to supporting moms so important? And, what do you do with that?
Yeah. So, I like to consider the type of sort of treatment approach and therapeutic approach that I use with my clients as one of sort of a mind-body holistic approach. And that is because there are unique needs that moms face, and that, we really can't address, anxiety or depression or other mental health needs just based on a theory that we may have learned, in our master's program, for example. That would be me, like as a clinical social worker, or any type of schooling. Well, that's really important and, sort of the foundation of our work. We also know that the treatment of mental health symptoms does need to be looked at from sort of a whole perspective, that it's not just about the thoughts that you're experiencing in your mind, or the painful emotions that you might be suffering from, but rather, how can we help you in all areas of your life? And that requires lots of thorough assessment to sort of figuring out what areas you're struggling with. And that's part of why I became a health coach as well, because I realized how important integrative nutrition was in supporting our mental health, especially with new moms, and the struggles they face in self-care and nourishing their mind and their body. So that's part of why I recently got that training, because I knew that was sort of a missing piece in my practice as well. But at the Nesting Place, we consider ourselves sort of a holistic wellness center where we provide lots of different services to all moms, from mental health services with practitioners like myself to having nurse practitioners, massage therapists, Reiki practitioners, nutritionists, physical therapists, health coaches, homeopath providers, to many, many other things. And that's sort of what we mean by the holistic approach, is that we take the whole picture of somebody and we help them to really nourish not just their mind, but their whole being, their whole body, with whatever it is that they're struggling with.
Yeah. And often obviously there's so many complex issues that go on, but it could even be as simple as, a new mom is not getting out of the house. She's not moving. She's not getting exercise. She's not, having the proper diet for herself and for nursing. You need so many extra calories and fluids and things like that without having, that real holistic approach, you may not get all those things. You may have mommy brain and not remember that you have to do this for yourself too.
Right. Absolutely. Yeah. So it really does take this interdisciplinary sort of approach to healing the mother. I mentioned before about who's holding the mother. And when we have a holistic team, we are really able to hold the mother and address all of her needs, in every different avenue and, different theoretical practices.
Yeah, so that would kind of lead right into this. So what makes maternal mental health services different than traditional psychotherapy?
Mm-hmm. Yeah, and it is very much a holistic approach. As maternal mental health specialists, we network and connect with all different types of practitioners, all of whom are trained in helping and meeting the needs of moms and whatever sort of scope of practice they have, whether it's mental health or, as I said, all of those other things. And maternal mental health specialists do require a certain set of skills, as a clinician, as a psychotherapist, that sort of a traditional psychotherapist, may not necessarily have. And that's why there is lots of training available. There's through Postpartum Support International, there's an internationally recognized certificate now that sort of legitimizes and justifies the area of maternal mental health. And more and more practitioners are getting that certificate. But it helps us to sort of stand out from a traditional psychotherapist and validates all of our hard work and all of the years of training that we have received, and really highlights the importance of looking at a mom from, again, sort of that holistic mind-body type approach. And if the practitioner, him or herself, doesn't have that skill set, how can we connect the mom with the practitioner that can meet those specific needs?
So is this kind of a relatively new thing? Because, medicine and the medical health field was so dominated by men, and even, it's been proven that there's so many diseases that are, heart disease for women, that are ignored because they've been studied in men for so long. Do you find that similar with maternal mental health?
I do. There are men in the field of maternal mental health. I do think they play a really important role in all of this too. And at the same time, I think even just what we were saying before about women in general, but even more specifically moms, admitting that they need help and what that means, and sort of fear of speaking out and saying that they're really struggling. I think, that's definitely a little bit newer, that when we look at sort of the traditional gender roles in a home and what, women were supposed to be like, only, a couple of decades ago, and how much that's changed, even just with feminism and so many more women working, so much has changed, and the view of women and moms in particular has definitely changed. So without a doubt, this has become a much more specialized field, in terms of psychology and psychotherapy. It's one that should have been around a long time ago, of course, because we know, even though the field is relatively new, women and moms have been suffering for
oh my gosh, yeah,
years and years and years. So but I'm excited to be a part of this newer field of practice.
So going back to the mom, so we know that it's such a hard journey adjusting to motherhood, but how can a new mom know whether what she's feeling is normal versus needing professional help? When should she go and seek assistance?
Yeah, I think that's an important question. And again, I know I keep saying this, but it does go back again to sort of that traditional role of a mom. And it's important to point out the differences, what's normal versus what's not normal. So many women ask that question is, what I'm experiencing right now, is this normal? Will it pass? Because if it's normal, then every other mom must have experienced it, and therefore it should pass at some point. And that's sort of that misconception. So we know that approximately 1 in 7 moms experience postpartum depression, anxiety, or another mood disorder in the perinatal period. Perinatal meaning from the time they get pregnant up until postpartum. Those are just the reported numbers. And we know that, even just with the COVID pandemic, the numbers are likely increasing. We just don't have the literature yet to support those numbers. But we know for sure 1 in 7 moms experience a diagnosable mental health struggle in the perinatal period. We also know that up to 80, it is a big number. Yeah, it's a real big number. We also know that up to 80% of new moms experience baby blues. This is a term that most of us are familiar with, but baby blues basically is The mood changes due to, hormonal changes in the birthing process in new moms. That usually lifts 2 to 3 weeks postpartum after having given birth. So there's a large majority of moms who do experience that. But what so many of us don't realize is that if after 3 weeks postpartum, you're still experiencing what you think might be the baby blues, it's no longer the baby blues. And it's almost likely that you're struggling with your mental health and that professional help may be needed.
Yeah.
Unfortunately, there's not nearly enough accurate and thorough screening done by medical practitioners, OBGYNs included, of new moms to assess for the need for, additional mental health services. We really, really need to make a change, as sort of a systemic change with that, because that would be so helpful in normalizing what women are going through and assisting women in getting connected with the right kind of help. Assessment is the first step to getting help, but without asking the right questions, well, we're never going to know if a mom is struggling. And so that's why it's so confusing for new moms to know, like, is this normal? Am I supposed to be crying all the time? Am I supposed to be, consumed with fears and worries about my baby's well-being? Am I supposed to, sorry, go ahead.
Oh, no, please continue.
Oh, no, I was just going to say, a lot of moms, might be asking, is it normal that, I don't love this? Is it okay that I am not fully embracing this? And if we don't ask those questions, moms will continue to ask the questions to themselves without accurate answers.
Would you recommend then, after 3 or 4 weeks, if a new mom is still feeling this, that she does go and seek help?
Absolutely. 100%, and even before the 3 weeks, if a woman is struggling, even if it's just the baby blues, that's still hard. And it's still a challenge. And you don't have to leave it up to yourself to determine if you need help. If you're even questioning for 1 minute, is this normal? I'm definitely not feeling like myself. It's okay to admit that you might need a little extra help. And that's why maternal mental health specialists do what we do, because we have the training and the skill set to be able to really assess a new mom, or even a second or third time mom, to see if they really need help. And at that point, you would speak with the professional to determine the level of help that you might need. But there's never a reason to sort of suffer in silence and wait it out and see if things get better. If you're really struggling, then that's an indication that you need help. And believe it or not, a good mother, we talk about good moms.
Yeah.
A good mom is a mom who admits she needs help. And a good mom is a mom who is questioning if she's a good mom.
That's right.
Even just to think about it means that, you're doing a great job. You just might need a little extra help along the way. And there's nothing wrong with that at all.
Yeah. And it's true what you mentioned is that since every pregnancy is different, maybe you didn't experience anything like this in your first or even second pregnancy. And now with the new pregnancy, everything's different. So you are experiencing that.
Yeah, absolutely.
So if you could just give kind of one tip for a new mom who is feeling a little bit blue, to elevate herself and to just pull herself up a little bit out of that initially, is there one thing that you could recommend to do?
Oh goodness. Well, something I always recommend to any mom I work with, and something I try and practice myself, is we need to start with compassion for ourselves. If we are hard on ourselves, if, we continue to be our, worst critic, we're not going to get anywhere. We're not going to feel any better.
So true.
And so if you are struggling, remind yourself that it's okay, that this is really hard, especially if you're a new mom in the middle of a global pandemic. This is really, really hard. It's not easy for anybody, and it's okay that you're suffering.
Yeah.
Starting with a place of compassion and loving kindness for yourself will go such a long way, because if we're able to, if we're hard on ourselves, eventually we're going to start to believe that, and it's going to, come out in everything that we do. It's going to impact our mood. It's going to impact our mentality, or our continued thought process, our behavior. And if we're not kind to ourselves, it's really going to be hard to feel good, to feel happy, to be present in our life. We'll be so consumed by all that negative self-talk that it will be really hard to sort of clear that out and feel effective in any way in our life.
Yeah, I think that's a great tip, a great point. The other thing too is the sleep deprivation. I mean, you can't forget how little sleep new moms get. Have you found that, how big of a role does that play?
Yes, absolutely. That is a huge contributing factor to our mental health. Anybody, parent or not, who has experienced any form of sleep deprivation knows how much that really impacts, our physical health and our mental health. And so the lack of sleep is a huge contributing factor to exacerbating the symptoms of anxiety, depression, and other mental health issues as well.
And, the other thing is everybody just expects, oh my gosh, you have this beautiful new baby and you're automatically going to be bonded with it. But some moms do have some problems with bonding. And could you talk a little bit about, besides breastfeeding, because breastfeeding is just that natural bonding situation, but not everybody is able to breastfeed or wants to. But what else can moms do to initiate that bonding?
Mm-hmm. Yeah, that's a great question. That's actually a big part of the work that I do as well with a lot of new moms, and a lot of maternal mental health specialists also do incorporate attachment work in their work with moms. There are a lot of moms who come into motherhood with some type of insecure or limited attachment, even with their own mothers. And that can, in fact, impact your ability to attach with your new baby. And it's actually a misconception. Breastfeeding, while it can help with attachment, it doesn't always help with attachment, especially if the mother is struggling with her mental health. We know that moms who suffer from depression and anxiety are much more sort of emotionally detached and less present with their children. And so we know that, attachment struggles are very much present in moms who also struggle with their mental health, which is why it is a big piece to the work that we do. And so if there is a new mother who feels that she's not as connected with or as attached to her baby, even if she is nursing, that could be an indication that she could benefit from the support of a maternal mental health specialist. We can help her feel more connected and more attached with her baby through a variety of different things, and that there's hope. That you can develop secure attachment to your baby regardless of your own childhood, your own experiences with attachment in the past.
Yeah, that's amazing. And it seems like you have a lot of new things going on at the nesting place. You offer classes there. And so somebody now, obviously, since things aren't in person, they can book time with you over the phone, or how does that work up until you're back to in-person visits?
Yeah. So actually, prior to having to sort of shut down due to COVID, I was providing and will continue to provide telehealth services to my mom clients. As a maternal mental health specialist, so many of us do provide that. Many clinicians provide in-home services, or sort of we get creative in the ways that we are able to provide our services, because we know that so many moms have trouble kind of getting out of the house, whether they're experiencing anxiety or they're just overwhelmed with their new baby or babies. And so many of us had already been providing telehealth services to whatever extent that meant for, for the individual clinician prior to COVID. And so I do plan to continue that. However, since mid-March, I have, closed down sort of my physical office space and have been exclusively providing telehealth for now. Our hope is that we'll be able to open our brand new space in October in Farmingdale, New York, here on Long Island, where we will be able to provide in-person services, with all of the interdisciplinary practitioners on our team. But until then, we are providing almost everything virtually, which is really exciting because it also gives an opportunity to moms really across the world to be able to access so many of the amazing services and programs that we offer at the Nesting Place. One of the biggest programs and most popular programs that we offer is called the Fourth Trimester Support Series. And it's, to me, I love everything that we do at the Nesting Place. I wish that it existed when I was a new mom. The support that new moms get from a place like the Nesting Place is so invaluable. It's something we all deserve to have as moms. But one of my favorite things is the Fourth Trimester Support Series. And you could be a brand new mom with, a 2-day-old baby and access our Fourth Trimester Series from the comfort of your own home, which is pretty incredible.
It really is. And, in some ways, this whole virtual universe that has opened up is just so wonderful because it gives us ways to connect that we haven't really had before. And, a lot of new moms aren't that anxious to leave the house at first because it is a little bit overwhelming. So it's a wonderful service to provide that.
Mm-hmm. Yeah, absolutely.
And as we wind up, I had one more question. I think in terms of the mental health of a new mom when she's kind of overwhelmed by the visitors, whether it's in the hospital or in those first few days at home. What do you suggest for somebody in terms of managing family and friends who want to come and spend time, but it could be overwhelming?
Mm-hmm. Yeah, that is a great question. And what I'm hearing from your question is, how do we help new moms establish and maintain healthy boundaries?
Yeah,
something that's really challenging for so many of us. And some people seek therapy just for that alone. There's a lot of work that can be done around that. But something that I think is an important takeaway is that as a new mom, one of the more challenging things, but one of the most important things is to find sort of your mama intuition, that mom inner voice that not everybody has. It doesn't come naturally to all of us. But, as a mom, it's part of our sort of responsibility to be the voice of our children when they aren't being heard, or they don't have a loud enough voice, or they're not old enough to speak up for themselves, and to really be an advocate for them and for us, in terms of our own well-being. And so those early days when everyone wants to come over and see the baby and hopefully see you and help you out, even though that doesn't always happen, it's an opportunity for you to find your voice. And for some moms, it's a little harder, depending on your personality or the family dynamics. But if you can find your voice and start to, at your own pace, again, with compassion, speak up. For some moms, it's maybe they're not ready to actually say it out loud, but instead they need to write it down. Maybe they write it down somewhere, or they send it out in an email or a text, to sort of let people know what your personal boundary is for your family. And, maybe assign visiting hours, for example, so that people aren't coming in round the clock. Maybe it's, when people do come and visit, depending on who those visitors are, maybe you also, provide them with a couple of things that they can do to help you around the house. So many people who come and visit a new baby, they say, oh, what can I do here? I'll hold the baby, you go take a shower, or, something like that.
Yeah.
Well, maybe it's not a shower that you want, but maybe it's, some help folding the laundry or ordering in some dinner. So something an exercise I like to do with a lot of my new mom clients is, write a list of the things that you could really realistically use help with, and have that, post that on your fridge so that when visitors do come, you can give them, instead of them asking you, oh, what can I do to help? And you might feel a little uncomfortable letting them know, would you mind folding the laundry? You have a list of some ideas of things that they can do if they're willing. So another way for you to start to find that voice and figure out a way to communicate it and be an advocate for your well-being and ultimately the well-being of your child and your family.
I love that. Those are really good points. And it kind of helps you build that village that everybody talks about that isn't so easy for every mom to build. So, as the new visitors are coming, you can ask them to be part of that village, and for you to, enlist them a little easier in the future. That would be great. And I love seeing that list on the refrigerator so they know these are things that we really need help with.
Oh my gosh, yeah. And you can even start working on that, while you're pregnant or even, in the hospital. If as you start to think of things, just start writing it down. You can always edit it and, replace, items on that list as you see what's helpful and what's not helpful.
That's perfect. Thank you so much. This has been wonderful. And I'm going to have the links for the nesting place and everything else, the fourth trimester on the site. And thank you so much. It was wonderful.
Thank you so much for having me.
Points.
Yeah, my pleasure.